So again, the oral hypoglycemic agent. The oral hypoglycemic agent to treat the diabetes mellitus type 2. So the oral hypoglycemic agent divided into two types. First one is the sulfonyl urease. Second one is the meglitinides. First we discuss the sulfonyl urease. Sulfonyl urease. Then first we discuss the sulfonyl urease. So the sulfonyl urease release insulin. Increase release insulin. The sulfonyl urease increase the release of insulin in the beta cell of pancreas. Then the duration of action is more duration of action. The sulfonyl urease, it is the more duration of action. Right? Then the maintenance dose is the time. So you use in diabetes type 2. Right? Use in type 2 diabetes mellitus. The sulfonyl urease is used in the type 2 diabetes mellitus. So weight gain is more. Weight gain is more means increase. Increase means more. In the sulfonyl urease, the weight gain of a person is more in sulfonyl urease. If daily consuming of sulfonyl urease means it is the rapid increasing of weight. So this is the sulfonyl urease total action. Then the drugs. The first generation is chloropropamide. First generation is chloropropamide. First generation drug. The first generation drug of sulfonyl urease is chloropropamide. Then tolbutamide. Tolbutamide. The first generation of sulfonyl urease is chloropropamide and tolbutamide. The tolbutamide is high toxic and less potent. Is high toxic and the less potent. Always remember the tolbutamide is the high toxic and the less potent. So that the tolbutamide is not preferred. Not preferred. The tolbutamide is not preferred due to it is high toxic and less potent mechanism. Then second generation. The second generation, the second generation sulfonyl urea. The second generation sulfonyl urea is the glibenclamide. Glibenclamide. The second generation sulfonyl urea is glibenclamide. Then glyclazide. Then the glyclazide. Glyclazide. The second generation sulfonyl urea is glibenclamide, then glyclazide, then third one is the glimepiride, most commonly used. Glibenclamide, glyclazide, and the glimepiride, that is most commonly used, most commonly sulfonyl ureas that day-to-day life used in the type 2 diabetes mellitus. Then another type of oral hypoglycemic agent is meglitinides. Is the meglitinides is the another type of oral hypoglycemic agent. Clear? So it is less used. Less used. Yeah. The meglitinide is less used to treat postprandial blood sugar. Clear? The meglitinides is less used, and the meglitinide only to treat the postprandial blood sugar. In the control of postprandial blood sugar, the meglitinide is used. Clear? The drug is repaglinide. Clear? The drug is the repaglinide. The second one is the nateglinide. Nateglinides. Then third one is the metiglinide. The repaglinide, the nateglinide, and the metiglinide, all are three are derived from the meglinides group. Glinides group. Then Thaczelidinodions. triglycerides. The thiazolidinedione is the another type of oral hypoglycemic agent, that is the pioglitazone. This is the pioglitazone. The thiazolidinedione group drug is the pioglitazone. Pioglitazone. It is the another type of oral hypoglycemic agent to treat type 2 diabetes mellitus. The pioglitazone to treat the type 2 diabetes mellitus. Then the metformin. What is the mechanism of action? Metformin. Metformin to blocks the glucogenolysis. The metformin, how it work? To block the glucogenolysis means it do not generate the glucose in the beta cell of the liver. It do not generate the glucose of the liver. Then metformin is to treat type 2 diabetes mellitus. The metformin is to treat the type 2 diabetes mellitus. Type 2 diabetes mellitus. Then metformin side effect. Always remember the metformin decrease the vitamin B12 level. Decrease vitamin B12 and it causes lactic acidosis. The metformin side effect is the decreased vitamin B12 and lactic acidosis. If the lactic acidosis is occurs, then advise the patient the hyperventilation. And if the lactic acidosis occurs, then it causes fatigue and the myalgia in the body. So fatigue and myalgia is the symptomatic treatment should be occurs. So it is all about the OHA, oral hypoglycemic agent. So thank you.